Hello students, welcome to the class. Today we'll see what community psychologists do, the skills they require, the different settings they work in, their training and educational requirements, and some of the dilemmas faced by community psychologists. So before we see the role of community psychologists in social change, let us first revise what we have learned in the previous class, what community psychology is. Community psychology is the study of human behavior and development in the context of different environments. So community psychologists ask questions, explore options, and create the science and practice in which communities are the context for change. They want to better understand how and in what manner the ecology surrounding us affects what we as humans do and how we do it. So this includes both psychological constructs as well as the physical environments. And as the physical world around us becomes more and more toxic, what does community psychologists have to say about that? Let us look at a simple case study of a couple who are living near steel mill or a copper mine and decide to have a child. After 6 years, they notice that their 3-year-old son is not picking up language very quickly and has relatively minor but significant difficulty in learning fine motor tasks like holding a spoon. So he also has significant allergies. Parents get concerned and visit their local pediatrician. They receive a diagnosis and begin a treatment regimen involving behavioral and psychopharmacological medications. And since neither parent has a history of allergies or behavioral disorders, they are at a loss to explain the problems they are having. So, in this example, to what degree can we attribute this child's disorder to the very physical environment in which he was conceived, born, and grew up? Is it just coincidence that he has received the diagnosis? So, to answer all these questions, in the National Children's Study funded through the National Institute of Health and Human Development, among others, researchers are preparing to examine this question with a national sample of 1 lakh not yet born children across the country. And how community psychologists could contribute to the National Children's Study is through their knowledge. They know how to measure neighborhoods both within the context of social and physical settings and how to relate these variables to child and family interactions. And they also know that community psychology has a unique understanding of prevention science. They know that community psychology has the ability to understand environmental organizational processes and their effects on conservation, innovation, and transformation of institutions. And they know that community psychology is uniquely positioned to affect and support change in systems that provide health and development services to families. Now let us go in depth and look at the various roles they play, the different settings they work in, and the dilemmas they face, etc. Well, community psychologist seeks to enhance the quality of life of individuals within society and community. Their aim is to enhance the quality of life through collaborative research and action. And they specialize in health social element, health promotion, social modification in churches, workplaces, and community. So community psychologists seek to expand helping beyond traditional psychotherapy to promote wellness. They engage in action-oriented research to develop, implement, and evaluate programs. They base their work on scientific foundation to better understand the multiple influences of the social environment on health and wellness. And they build collaborative relationships with community members, groups, and organizations to solve social problems. They also consult with and provide tools to organizations to build capacity to address social problems such as exploitation and victimization. So basically, they try to imbibe in people a psychological sense of community and promote individual growth and prevent social and mental health problems before they start. They also try to provide immediate and appropriate forms of intervention when and where they are most needed and enable those who have been labeled as deviant to live as dignified and self-controlled a life as possible and preferably as a contributing member of the society. So what community psychologists do could be put under 3 points. They try to create and evaluate an array of programs and policies which help people control the stressful aspects of community and organizational environment. And they assess the needs of a community and teach its members how to recognize an incipient problem and deal with it before it becomes intractable. They also study and implement more humane and effective ways for formally institutionalized population to live productively in society's mainstream. So in all the work they do, community psychologists require a set of skills which includes interpersonal communication skills, social problem solving skills, organization skills, and research skills. So as community psychologists mostly work in collaboration with people, interpersonal communication skills are very important, and this group of skills ranges from personal communication to one-to-one and group listening skills to individual conflict resolution. It also includes motivating and activating others, enabling participation, providing basic counseling where required, persuading, challenging, and developing rapport and relationships with a wide range of people. And they also need an understanding of group working from the formation of group to long-term work. And group work includes consciousness raising, working with cooperation and collaboration, and network development and support. The next set of skills they require is the social problem solving skills, which includes skills of resource procurement, planning, observing and understanding influences on people's behavior, strategic decision making, and creative thinking about methods of working and for enabling participation. It also includes skills of multi-level system analysis, identifying relevant stakeholders in a community, as well as ways of maximizing resources. And as they often work in organization setup to enhance the work environment, they also require skills of managing projects, including the supervision of workers, office administration, use of computer and new technology, and managing pressure and multitask workloads. And they also need to work with interagencies, build relationships with other professionals, and the forming of interagency alliances. As more than half of the time, community psychologists conduct research to identify issues in the community, they need skills of designing relevant projects, collecting different kinds of information, and analyzing those information. Furthermore, they also need skills of spreading information orally, visually, or through written presentation. They also need to see to it that they facilitate participation from the marginalized group of people in their work and share information with others. So we can say that community psychologists must have a broad base of knowledge related to community interventions and an understanding of community psychology intervention theory and the intervention theories from different disciplines is also essential. So we can say that at the individual level, community psychologists need skills in communication, assertiveness, consultation with individuals, the ability to be open to personal development and consciousness raising. And at the level of group and organization, the skills they need are group process facilitation, group intervention, organization development, including visioning, team building, and program and intervention planning. And at the individual level, the key skills they need are working in solidarity with disadvantaged people, community development, community organizing, and influencing social policy. While community psychologists work in collaboration with people and de-emphasize their role as an expert, they are trained professionals who have some core competencies that includes values, social ethics, and the ability to think critically, knowledge of community psychology theory, research and action, and a host of community psychology skills. So we can categorize the community psychologist role under 4 heads that includes facilitative roles, representational roles, educational roles, and technical or researcher roles. So under facilitative roles, we can say that they play the role of a listener, a motivator, group facilitator, participation enabler, and organizer. And in representational roles, they play the role of an advocacy worker, resource procurer, media presenter, and networker. And under educational roles, they work as a consciousness raiser, informer, challenger, problem solver, and trainer. And under the technical or researcher roles, we can say that they play the role of project planner, funding and financial controller, data and policy analyzer, and evaluator. Community psychologists work in a wide range of settings, often working as program directors, educators, researchers, consultants, and public policy developers. And the values and ethics that they practice at work, they live the same at home, because it would be inconsistent with the values of accountability to witness injustice at home and remain silent, just as it would be incoherent to behave compassionately towards society but despicably towards family members. So community psychologists practice their ethics and values at home and in other settings like human services, setting for social change, alternative settings, etc. And human services is a generic term for organizations providing health, mental health, disability, housing, community, and child and family services. And these organizations can be a part of government, funded by charities, or private agencies. An example of human services include community mental health centers, children's mental health services, counseling agencies, alcoholism and substance abuse treatment facilities. And in the settings they work for social change, community psychologists have an opportunity to participate in social movements as organizers, consultants, researchers, or citizens exercising their power, their democratic right to voice their opinion. And there are a number of social movement organizations with which community psychologists could involve themselves, like anti-poverty movements, feminist movement organizations, etc. Sometimes community psychologists also work in alternative settings, such as voluntary associations formed and controlled by people who share some oppressive conditions. So in different settings that they work, community psychologists might find themselves conducting research in a mental health center on Monday and appearing as an expert witness in a courtroom on Tuesday and evaluating a hospital program on Wednesday, or implementing a school-based program on Thursday and organizing a community board meeting on Friday. So in all the above reasons, there is a sense of vibrant urgency and uniqueness about community psychologists. And in all the works they do, the major goal and the guiding vision is to have a society free of racism, sexism, poverty, violence, and environmental degradation, a society which celebrates diversity, shares its wealth, and preservation of the natural environment. As community psychologists work in different settings for social change, there are number of places they work, which includes academic settings such as community colleges, small undergraduate college, and larger universities, and health and human service agencies of city, county, state, and federal government, school, community-based organizations, etc. They work for public policy and non-profit organizations, research centers, and independent or consulting groups, evaluation firms, and private practices. Well, most community psychologists hold at least master's or a doctorate degree in psychology. There are also community psychology programs available, and students can opt to earn an interdisciplinary degree or a general degree with a focus on community psychology topics. And some of the coursework that an aspiring community psychologist should take includes social behavior, research method, statistic, public health, organizational development, developmental psychology, sociology, social problems, and community development. So now, having seen the different roles they play and the different settings they work in and their educational requirements, let us see some of the dilemmas that community psychologists face. One of the major dilemmas they face is what right do they have to convince people to work for social change, to work up people, to rebel and oppose convention. So in their view, the ethical way to proceed with this is to share their vision, their conviction and their analysis and strategies with people they work with. So they try to convince people that the change would be for the betterment of the society and for themselves. So most psychologists following the community perspective see it as their mission, not just to tear down outmoded ideas and practices, but to help create or improve service organizations and other institutions. So they work to achieve the goals of providing humane and effective care and less stigmatizing services to those in need while enhancing human psychological growth and development. So the new and disparate areas of community psychology are thus bound together by a single vision, that of helping the relatively powerless in and out of institutions take control over their environment and their lives. And in doing so, community psychologists wear many hats to create society. So in creating a desirable and healthy society and community, community psychologists analyze civic life, government and workplace settings in order to understand and improve fair and diverse participation. They fight oppression and work to reduce social inequalities and work with marginalized people towards their empowerment. And they find ways to help disadvantaged individuals, make them feel more connected with their local communities. They also work with minority people to make them feel more connected towards society and develop and implement and evaluate action-oriented community-based programs. They also build relationships between individuals and community members, evaluate organizations, government and communities in order to promote participation and diversity. So we see that they engage themselves in a host of work in different settings to create that desirable society where every individual's differences would be respected and they would not be judged against one single standard. So in their work, community psychologists also face many dilemmas. As I already said, they often might find individuals who are opposed to change. So what right do they have to convince people to work for change, to oppose convention and to rebel? So community psychologists would have to convince them that the change would be better for themselves and for the society, and that the intervention that they are implementing would work in their favor.